Hi, I'm Dr. Mark Poray, family chiropractor in Brooklyn, Ontario. You know, lately I've seen a number of pregnant women with low back pain in my office, so I thought it would be a good idea to address this very common concern. During the third trimester of pregnancy, pain becomes much more familiar. Your body has undergone many changes, adding a lot of physical stress, both because of daily increasing weight and the effect of pregnancy hormones. Now, back pain, hip pain, pain running down the buttocks, hip and thigh pain are all common concerns of women in the late months of pregnancy. So let's try to address some of the causes of these pains and see if there's something that can be done to minimize them. First of all, as far as low back and hip pain is concerned, in pregnancy, the uterus has gotten big and heavy, and this necessarily changes your posture and your gait. These changes in spinal curvature forward move your center of gravity, put strain on the lower back and hips, resulting in pain, which may be more severe on one side than the other. The pregnancy hormone relaxin, which I'm sure you've heard about, loosens the pelvic ligaments so that you can deliver the baby, but this also contributes to low back and hip pain. The best way to make sure your hip and back pain it gets better is to exercise. Getting your back and abdomen in better shape can reduce the pain. You may also want to apply heat to the region with a compress or a warm bath. Now, as far as exercise is concerned, if you haven't been doing exercising before, you may want to start very gently. If you have been doing exercise before, then you can continue at a slightly lower level. Make sure you talk to your doctor about this before you actually start a formal exercise program. Now, sciatica is a pain which runs down your buttocks, the posterior thigh, hip, and the back of the leg. It's caused by a compression of the sciatic nerve. The sciatic nerve runs from your lower back down your leg all the way to your feet on both sides. In pregnancy, the likely cause is your enlarged uterus pressing on this nerve, causing you to feel anything from tingling and numbness to outright pain. Because pregnancy is not the only cause of sciatica, you should tell your doctor if this is what you think you're having. Some ways to ease sciatic pain can include applying heat, taking warm baths, as I said before, sleeping on the side opposite of the pain, and in the weeks close to delivery, the baby's position is likely to change and inside the uterus, and it's less likely to actually cause that same pain. So for women who are expecting, the development of front thigh pain can be associated with a muscle tear, but typically, since women are decreasing their levels of activity during pregnancy, this is rarely the cause. Unlike rear thigh pain, which is usually caused by postural changes, front thigh pain can result from the growing baby pressing directly on the femoral nerve, which runs through the pelvis and down the front of the thigh. When it comes to chiropractic care for these problems, it's best to have your chiropractor examine all the possible causes and advise you as to the likelihood of success from spinal or pelvic adjustments. There's an interesting dichotomy of issues involved with low back, hip, and thigh pain during pregnancy. The same hormone, as I mentioned before, that loosens the ligaments of the spine and hips during pregnancy allows the joints to move more easily, causing nerve root problems, and it also makes spinal and pelvic joints easier. So during pregnancy, it becomes equally important to see your chiropractor more often as the pregnancy progresses to deal with these painful issues, and also to ensure a smooth natural delivery or smooth natural movement of the pelvis and spinal joints during delivery, making it easier, obviously. Now, if you have any concerns about traditional chiropractic adjustments or manipulations, you can ask your chiropractor to use a mechanical adjusting tool like the neuromechanical impulse instrument, which also becomes more effective thanks to this hormone. By the way, the effects of this hormone may continue for some time after delivery, so keep that in mind. The American Pediatric Chiropractic Association recommends chiropractic treatments once per month during the first trimester, twice per month during the second trimester, and weekly during the third trimester. Now, your chiropractor may have an idea about a slightly less intense program, so keep that in mind. I'm Dr. Mark Poray. If you're interested in video blogs on other health matters, please visit my website at www.drporay.com. You can make an appointment for a consultation at my office by calling the Brooklyn Family Health Center, where we also have homeopathic care, acupuncture, massage, and colon hydrotherapy. Our phone number is 905-655-5767. Thanks, and have a good pregnancy and a healthy baby.